This material is made available to you by or on behalf of the University of Melbourne under Section 113P of the Copyright Act 1968. It may be subject to copyright. For more information, visit the University Copyright website.
Probably not. There's an excluded goods order, which deems certain things to not be a therapeutic good. So a therapeutic good is anything that needs to be on the register in order to be sold in Australia. So it's anything that the TGA regulates. And transplants is one of the things that the TGA specifically says it doesn't regulate. Right. So blood products and clotting factors. This was in the last quiz we did. Is it a biological or a medicine? It is a little bit tricky. That's okay. So that's a medicine. All right, so we have bone marrow transplants. Now, that's a tricky one. Then we have ocular tissue. Yep, that's a biological. Oh yeah, it's right there. Damn, with my tissue. All right, reproductive tissue. So, cardiovascular tissue. Damn it. I did not think this through. Okay, bone and tendons. Yes. All right. So this.
What's the difference between a lung transplant and a bone transplant?
So a lung transplant, it's all about how much manipulation happens to that tissue and to that group of cells. And we will cover that in one of our slides. So we're going to talk about minimally manipulated versus manipulated. And also, transplants, whole organ transplants or partial organ transplants are specifically in the excluded goods order. So they're specifically deemed not to be therapeutic goods, and they fall under a different subsection. So we're going to look at those as well. So today we're going to look at what's a biological and what isn't, the Australian Biologicals Framework, classes, current uses, the registration process, exceptional release provisions, these are my favorite, and post-market monitoring. Only a little bit of it because we're going to have a whole lecture on post-market monitoring tomorrow. Right. So what are biologicals? So basically anything that's in a tissue bank. So we have a number of tissue banks in Australia. And tissue and therapy products in tissue banks, certain stem cell therapy products, excludes in vitro, so IVF products are excluded. They would specifically be under devices. It excludes blood because they're under the medicines provision, as we've learned. And we've got to keep in mind that other countries might use different names for these products. Right. So different levels of regulation to products based on the risk associated with their use. And it was specifically, so this group was specifically designed to accommodate emerging technologies at the time. So in 2011, these were seen as the next big thing. Right, so they allowed some flexibility. So again, so we have fresh viable organs are not regulated by the TGA. Fresh bone marrow transplants are not regulated by the TGA. However, if you have a bone marrow bank, then it is. Okay, so this is quite specific. Cells and tissues made by a single medical practitioner for a single patient under the care of that medical practitioner. So this is an exemption that we're actually going to talk about because it's quite important, and this is the loophole that a lot of those 3D bioprinting medical device companies use. Okay, so then we have stuff that's regulated but not as biological. So we have other tissues, so animal tissue products or synthetic tissue products, or products that have been grown in a massive vat using bacteria. So vaccines, plasma derivatives, certain blood and blood components, and some non-fresh transplants. Then we have biologicals, so anything that is stored in a tissue bank. Then we have certain cell-based products. such as human stem cells and T cell therapies, but again, it's on the provision that it depends on how manipulated they are, and some combined products. All right, so this is a much bigger excluded goods order. So this is the main one that lists a whole bunch of stuff, but I've just taken the stuff that's most specific to us. So this is word from the excluded goods order. So the TGA specifically says, these are not therapeutic goods, we don't care about them. There might be some specific stuff with the post-market provisions that you still need to keep, despite of the fact that it's not a therapeutic good. But for all intents and purposes, if it's on this list, the TGA doesn't touch it. So we have viable human organs, parts of human organs, direct donor to host transplantation, and it has to be within the law. So we have fresh, viable human progenitor cells from one donor to a host, so bone marrow transplants. Now, the tricky one is when it comes to human tissue and cells that are so collected from a patient who's under the clinical care and treatment of a medical practitioner and manufactured by that. So it has to be all within the same procedure and for a specific patient. So your own stem cells, if they collect them from you, it's in a registered hospital. It's from a specific patient for a specific patient and only for that patient. Even if they're manipulated, it has to be done in-house. If they send the cells externally, such as to a commercial lab for processing, it automatically becomes a therapeutic good and it's no longer covered by the excluded goods order, right? So it has to be done in-house. So this often happens, like they might get some fat cells, process them and inject them back, right? So a lot of those clinics that were injecting stem cells left, right, and center were excluded specifically because of this. They were often taking your stem cells and injecting them back, which means it wasn't regulated, which means they didn't even have to prove that what they were injecting back was therapeutic, still alive, had any evidence whatsoever. So you had an increased risk of infection because obviously injected something into your joint, but there was very little evidence of what you got back out of it. So there was no cost-benefit analysis done, and you paid a lot of money for it, and it could be done by any registered health practitioner, so not necessarily a doctor or a surgeon. A nurse could do it, right? And there were a few cases of, especially in beauty clinics, weird stuff being injected into people by underqualified staff. All right, reproductive tissue for use in assisted reproductive therapy is specifically excluded. Now, we've looked at this slide before in the last lecture. I'm not going to spend too much time on it. Needless to say that these products, I hope you guys can just have a general idea of what they are and remember them. They're regulated as medicines, so not a biological. So immunoglobulins, blood products and clotting factors, enzymes, and hormones. So anything that's sort of processed out of the blood is probably medicine, and if it's used, it depends on what its primary function is. Now we come to the new and experimental products. So this category was designed to accommodate new products. So stem cell therapies specifically are largely new, experimental, and high risk. Even though they've been around for about 10, 15 years now, they're still considered to be new and experimental. So they make a lot of promises, but the efficacy of some of these treatments is still quite questionable even 10 years later. They've been used for Parkinson's disease, spinal cord injury, heart disease, stroke, arthritis. They've been injecting all kinds of stuff into people's brains to try and reduce seizures. The list goes on. So I think last I read was like they're doing cord blood cell transfusions for young children at high risk of developing type 1 diabetes to see if that delays or stops it. I'm curious to see what the outcome of that trial is. And patients are usually willing to accept any of the risks involved, and at the cost of taking immunosuppressants for the rest of your life, which might not seem like a big deal now, but it is down the track. If you're A, trying to get pregnant, B, have comorbidities and need to take a lot of other medication which will interfere with it, C, get old and your immune system goes downhill in a hurry, right? So It's watch this space. So a lot of this stuff still needs, it needs a lot of research. So is it a biological? When you're asking yourself that question, first question to ask is it actually covered by the, what is that? Excluded goods order. How manipulated are the cells? So minimally manipulated versus not manipulated versus not minimally manipulated. So minimally manipulated might be something you just spin them down, or you put them through a washing gradient. So you might want to reduce them and just take the cells and get rid of all the other crap that comes with the sample, right? And then you put them back. Manipulated might mean you culture them overnight and get them to increase their numbers. I don't know what that is. We're having technical difficulties. Are you guys okay with watching the other screen? All right. So the big question is it autologous? So is it your own stem cells, or is it a commercial cell line? So if it's a commercial cell line, chances are it's going to be a biological. Is it a human tissue? This is an obvious question. Or a human source? What is its main application? What assessment and risk profile do you think applies? And how do you obtain it? So I don't know if you guys read an article about all these funeral homes that were illegally harvesting tissues in the US to sell, to commercially sell, and they all got raided like last year, and a whole bunch of, it was a big scandal, and a whole bunch of them closed. Did they get closed down? I can't remember what happened, but Google it. It was really interesting and horrifying reading. So anyways, biologicals are very, very commercialized in the US. Yes?
You mentioned that if it's a commercial cell line, it's likely to be biological. Does that mean an autologous cell line is not biological?
Yes. An autologous cell line is generally excluded, but it depends on how manipulated it is. Right? So if you've added growth factors, you've cultured it for a couple of days, you might have done other stuff to it, then it could, it's a really gray area. And this is actually undergoing changes at the moment, so they are looking at tightening the exemption for autologous stem cells because everyone's using them to get out of jail. Yes, so this is actually going to change probably in the next 6 months. So they've added that they're introducing new regulation. They had a consultation about it last year, I think. Anyhow, so biologicals are not super commercialized here because we have our lovely Medicare, at least for the moment, depending on how the new government goes. So because Medicare covers this, there's not a lot, there's very limited amount of money you can charge. So you can charge for like cosmetic purposes and sports purposes, but in terms of hospital use, it's all regulated through the tissue banks. And it's all funded through Medicare and various other models. So there's no direct selling to consumer most of the time. So not all the time, but most of the time. So it's not a huge profitable market like it would be in the US. Clinical trials. Does this look familiar? CTN versus CTX. So same sort of stuff applies as it does for medical devices and for medicines. So this has popped up 3 times now. Take note. So, clinical trials with biologicals in Australia will offer access to new but unproven therapies. So which one do you think it's going to be? And each trial has a research purpose, and patients need to provide informed consent, and you guys know how I feel about informed consent. And again, you're expecting that most clinical trials for higher risk biologicals will take a good number of years. So even though we've had stem cell therapies around for over 10 years now, we're still waiting to get some of this evidence today. And you might need more than one ethics committee. So that's the big difference. All right, so the risks are generally accepted to be higher than with medical devices and medicines. There's also an increased risk of infectious disease transmission. I mean, think about it. How are you going to sterilize a piece of tissue without actually denaturing and killing the cells in it? You can't use any of the standard methods that you'd normally use, right? So you can't put it in autoclave. You can't use ethylene, well, for some stuff you can, but I wouldn't recommend it. Ethylene oxide, you will denature a lot of the proteins in it. You can't use alcohol because that will kill a lot of the cells. So it's, yeah. So, and there is limited clinical experience with biologicals, and there are a lot of unforeseen side effects. So initially when we first started doing organ transplants, the screening was somewhat limited, and we had stuff like a whole bunch of people using one donor contracting HIV and other diseases that weren't screened. I think last case I read about was there was someone with metastatic cancer that donated a whole bunch of tissues. They put them in patients, including a child, and then gave an immunosuppressant drugs. And what do you think happens with cancer cells when the immune system's suppressed? They go kind of haywire crazy. So they had a couple of patient deaths associated to that, and that was just from one donor. And after one donor will contribute to up to 10, 12, maybe even more patients. So depending on which tissues were donated. But I still want to encourage everyone to donate tissues if you are so inclined. Okay. And unlike with medical devices, even though this is questionable for some medical devices, biologicals cannot be removed once they're in the recipient's body, despite the scientists' best efforts to date. So they're talking about introducing suicide genes and such, but this hasn't really worked so far. Okay, so what are stem cells? I'm hoping you guys already know this, but they're basically a type of cell that can turn itself through division, can differentiate into multiple different types of cell. So undifferentiated stem cells can make more open cells, or if they're initiated via various signals or growth factors, they can then differentiate into a specialized cell or a tissue. Right. So I tell you this because I'm going to tell you a story. So mesenchymal stem cells are the ones that we usually get from like the fat pad in the knee or from like the abdominal fat or whatever. And depending on what growth factors we give them, or depending on what tissue you put them in, they can differentiate themselves into, what can they do? Oh yeah, bone cells, cartilage cells, muscle cells, fat cells, and I'm pretty sure blood cells. So the stimulating factors can be systemic, so you can give someone a drug that will induce these cells that you then give them to turn into something specific. Or you can put them in an environment where there's lots of local factors. So if you take a stem cell and you put it into skin, because it's exposed by skin cells that are releasing local skin factors, skin growth factors, it will differentiate into more skin, right? If you take stem cells and put them into bone, same thing. If you take stem cells and put them into muscle, technically you will get some muscle cells. Whether they'll be like perfect muscle fibers, probably not. All right. So, differentiation is highly dependent on stimulating factors. Keep this in mind. So, this was in the US, surprise, surprise, in 2012, and I think it was in, what was it? Oh, God, they had a show named after it. You know, that rich area in the US? 902 Beverly Hills, that's it. This happened in a beauty clinic in Beverly Hills at the time, offering top-of-the-range cosmetic procedures, which were not regulated in the US at the time. So all that said was that a medical practitioner had to do it. What they put in there was like totally up to them, and companies could sell whatever they wanted, from like pink dinners to various, like, I think one of the dermal fillers ended up having like compounds commonly found in industrial cement and like tile grout. Anyhow, long story short, this lady was convinced to have mesenchymal stem cells extracted from her stomach fat and injected around her eyes. In theory, legitimately it looked good on paper. This would cause these stem cells to differentiate into new, beautiful, young-looking skin cells around her eyes, filling in the wrinkles, and it would cause the existing skin cells around there to differentiate further and grow better, right? So they thought, why not? But whoever did this was quite negligent and didn't do their homework. So along with putting in these stem cells, they also decided to top it up with some dermal filler. Right, now, I don't know if you guys know much about dermal filler, but it's usually any sort of material that will plump up the skin. It's horrific, ugly stuff. Don't ever use it. It causes a lot of deformities, And go and watch that show I told you about. Like, I think 40 to 80% of those cases is all about dermal filler gone wrong. Anyhow, long story short, so one of the main components of dermal filler is like a calcium, it's minerals, right? So naturally occurring minerals. The main one was calcium hydroxylapatite. Anyways, if anyone had Googled this, they would know that one of the primary responses of inserting this next to stem cells, this particular compound, is that it tells them to turn into bone. So this woman had stem cells put around her eyes and then topped up with dermal filler, which told the stem cells to differentiate into bone shards. And this is like basic 101 math. This is pure negligence. So this woman ended up having bone shards growing and developing in the muscle and tissue around her eyes. And every time she blinked, she was in tremendous pain. And they grew longer and sharper. And she had to have surgery to then have them all removed. Right. Okay. Yes, so they turned into bone. She had to have surgery. She was very unhappy. She paid $20,000 for this wonderful procedure. And then she had to pay more to actually go to an eye surgeon to have it removed. And I think she had to have several revision surgeries because those cells can actually migrate around the eyes. So she, I don't know if she lost a part of her vision, but they definitely did quite a lot of the damage in the orbital nerve and the orbital muscle. And there was actually some issues with the bone stability around that area as well. So, user beware. All right. So I was just saying, both temporary and permanent dermal fillers are evil. So there's this show on Netflix at the moment, and as I said, I watched it all in one sitting, and they actually show the surgery and all the results in quite a realistic manner. And it shows you exactly why regulation is so important. So this is based in the UK, where regulation is somewhat pick and choose. So some things are heavily regulated and some things are not. Now, I personally don't get the people undergoing these sorts of procedures boggles my mind, but I understand that that's not typical, and a lot of people have at least at some point considered this sort of work. I mean, other than my questionable fashion sense and exercise habits that can at best be described as quite sporadic, I'm quite happy with what I've got. But if you ever need convincing to come over to my site, have a look at the show. It'll make you very, very thankful to have the body that you have. And even the procedures that are considered to be good when shown in a certain light, I don't think look very good at all. Anyhow, long story short, so yeah. If you're a young woman, watch it. Where was I? Yes, regulation takes into account risk. So again, the higher the risk, the higher the regulation. There's not a lot of low-risk biologicals, but there are some. All right, so the risk class depends on how far removed they are from their naturally occurring state. How much have they been manipulated during the extraction and production process, and what do we do with them, and what do we mix them with before we put them back? How closely the intended use matches the natural biological function. So if it doesn't match the natural biological function of what you're putting back in, then it's probably higher risk than if it does. So as I was saying before, if you centrifuge something or wash it, that might just be minimal manipulation where you're trying to get a good concentration of cells to put back. So you just want a little pellet that you can then pick up and inject back. If you're doing several cycles of growth, if you're putting in genetic modification or extra growth factors, then that would be an example of high manipulation. And the main risk with using biologicals, the most common risk is the spread of infection, but there are smaller risks such as cancer and these cells not behaving in a way that you'd expect. Also spreading around the body. They don't generally stay in one spot, I know. So biologicals are grouped into classes. Now it's actually quite hard to decide where your biological fits in. So I just want you to be aware of these classes. I'm not going to ask you to put something in a particular class, but So let's say skin for wound covering would be a low class, that would be class 2. Then we have mesenchymal cells for treatment of graft versus host disease. Then we have bone mixed with carrier. I don't know what that is. I should know that. That's not bone cement, that's something else. Okay. Dermal fibroblasts. And then we have genetically modified T cells used to treat specific virus infections. So stuff that we've manipulated quite heavily. All right, current uses. So cranial transplants are not deemed to be an organ transplant. They're a tissue transplant. Skin grafts. Now, biological heart valves, but this is for fully biological heart valves, and they're often a combination device, and depending on the type of biological heart valve, it would be deemed to be a medical device. Then we have bone transplants that are donated by other patients. That would be a biological. And tendon transplants, and then we have messing around with stem cells, as discussed. So, the most common human tissues currently in Australian tissue banks, I want you to know these. So, ocular tissue, so there's a specific tissue bank for all of these. Ocular tissue, skin tissue, cardiovascular tissue, bone and tendons. Now, I need to mention that there are special private commercial tissue banks, but they're usually for like cord blood freezing. So there's at least 2 that I know of for freezing cord blood of your child. So if you don't want to give it to there's like one public register where you can donate your cord blood to, but there is no, so it goes to whoever needs it, and you can donate it for free. And if you ever need a bone marrow transplant, you get matched against this registry. However, there's no guarantee that you'll ever get your particular cord blood back. Right? It might have been used up, so you get whatever you get. With private cord blood banks, so there's a big question as to whether it's worth freezing cord blood. So a lot of you get these as like baby shower gifts these days. So if you, let's say, have a high risk of developing blood cancers in your family, then it's probably a good idea to have some cord blood frozen when you have a child, if you know that there's an increased risk of getting leukemia or any of the blood cancers, right? Or, for example, in my case, if you have an intraracial child, so my partner's Chinese, if we ever needed a bone marrow transplant match, if our kid ever needed one, there's no way in hell that they would find one with the right mix of factors, sorry. So yeah, so they wouldn't match. So it's sort of, it can be quite specific. So someone from a Macedonian background would have certain, oh my God, I've lost my words. But anyways, the tissue match just wouldn't happen. So if you have an interracial child, it's a very good idea to do that, but it'll set you back about, I don't know, $3,000 or $4,000 a pop to freeze it for 18 years. So it's sort of like an insurance policy. You kind of really don't want to pay for it, but if you need it, you want it to be there. Yeah, okay. So there's other types of private tissue banks, but that's the most common one that you'll find in Australia, and it's probably the most successful one. Okay, the process for inclusion of biologicals on the ARTG is pretty much the same as for medical devices and for medicines. So they look at quality, safety, and efficacy, with the main difference being that they do extra assessment on it. So as part of the whole assessment process, they have the advisory committee on biologicals, which approves this and then sends it to the delegate, as we saw with medicines. So they also look very carefully and inspect your facility of your process of manufacture for biologicals. So how do you collect your tissues? How do you process them? What do you do with them? How do you store them? That sort of stuff. In addition to everything else, they will also scrutinize all of your clinical data and all of your clinical trials and come to a decision. Okay? And they will seek independent expert advice about issues related to biologicals for almost every single application, unless it's been done many times before. They also have specialists working for the TGA, but they do expect the applicant to actually supply most of this data. So donor selection and testing, control of manufacturing and transport, microbial control. Then they're looking at stability, so how long do you expect your tissue to be viable for? So you have to have a shelf life. Critical materials, the quality of materials that come into contact with the product, what are you adding to it? And finally, labeling to allow for donor traceability. So if something goes wrong, how are you going to find who you put all these wonderful tissues into? So when using banked ocular tissue from deceased donors, tests for viruses such as HIV, HCV must be validated through testing of the blood of the deceased donor. So just testing the tissue is not enough. And again, you have to have a lot of traceability. And if you don't have it, you're not going to get through. All right, and safety and efficacy data. So again, we were talking about non-clinical data. So this is evaluated by toxicologists, but we were talking about biological dynamics and kinetics laboratory data. Toxicology data is a big one. And we were also looking at evaluating the potential of that particular cell to turn into a tumor. Clinical data, and this looks at specific clinical trials. All right. So then we have therapeutic goods orders are legally binding instruments, and they can actually specify donor selection, traceability, bioburden testing, and storage and transport conditions. So there's good manufacturing practice, yet again, specific for biologicals. All right, so I like this because it's one of the few, humane things that they'll bend rules for. So there is an exceptional release provisions for biological to treat life-threatening conditions. So if someone's at death's door and they absolutely cannot wait to get clearance to use that particular organ, there is a special provision where they will sort of look at the risk and give it to them anyways. So if there's a pediatric heart valve becomes available for a very, very ill baby that doesn't have any other treatment options, and this is a perfect match, but it's not possible to wait the 10 days for tissue microbial testing results, they're going to let you put it in. You have to make a special application, but it will probably be approved. So even though this is one of the few exceptions where even if it doesn't meet the required safety standards or current manufacturing standards, the TGA will still release the product due to the exceptional circumstances. So, and this does actually get used. So, all right. So again, there's a very, very heavy emphasis on post-market monitoring, which we're going to talk about tomorrow. So you have to report any adverse events relating to unintended harmful effects or anything that goes wrong, pretty much. There are existing processes established within the TGA specifically for biologicals. Sponsors are required to monitor, record, and report all adverse events to the TGA, also medical practitioners, patients, and others. So if you have used a biological and something's happened, you can actually, as a consumer, just ring up the TGA and let them know what happened if it's something that you're concerned about, even if it's a low-risk biological. Same with medicines, actually. The TGA will investigate and respond to adverse events as appropriate, and they do that. In addition to the mandatory reporting, there's voluntary incident reporting scheme. So they have this data bank, and if it gets more than one hit, usually it pops up a flag, and the flag goes to the relevant person. They review it, and they can initiate a full review by the TGA. So every notification counts. And one of the failures that we're going to look at during our next lecture is when these flags are dismissed and what can actually happen. So what do you need to know from this lecture? I want you to know what biologicals are. I want you to know what isn't a biological. I want you to know that tissue banks exist and what's their purpose. And I just want you to be aware of the fact that there is a classification system, but I'm not going to ask you to put a particular biological in it. Is that clear? Any questions, please? Yes.
Is animal tissue considered biological?
Nope. It's considered to be a medical device. So if you look at the medical device lecture, it specifically says if it contains tissues of microbial origin or animal origin, it is a class 3 medicine. Anyone else? Also, if you think dermal fillers are bad, have a look at permanent dermal fillers. They never end well, even if they look good for a couple of years. They look horrific. When your skin, you start aging and your skin starts like normally as part of the aging process, it loses its elasticity and it starts sort of sagging, and all those permanent lumps of filler start to migrate all over the place. It's really horrible. And you can still get an infection even 5 years down the track. Then they have to open it up, scrape everything off, sew it back up, and hope for the best. Okay. Awesome. I'll see you guys at the workshop. Now, this workshop is going to be content heavy, so I really, really hope we can finish it in time. So if you could please have a quick look at the slides, they're already up, and so is the reading material. It's all stuff I've submitted as reading material previously. But if you could have a quick look at it, that would be great. If we finish everything during this workshop, we'll spend next workshop about jobs in the field. Okay? Thank you so much, and I'll see you later. And we're early for once.